This is my Otic medication video. So first things first, of course, MAR versus doctor's orders. We want to make sure the patient, date of birth, John Smith, October 21st, 81, October 21st, 81. We want to make sure all the medication and dates are exact. So today we're doing polysporin eardrops. Time, everything looks exact. So we can go ahead, do our 5 writes and our 3 checks. So we'll do our first check when we're pulling the medication from our medication drawer here. Alright, so here we have our polysporin eardrops. Okay, polysporin eardrops. 2 drops. John Smith. Right ear, 80M. Okay, so that was our first check. We're going to be sure to check the expiry date. It doesn't expire till next year, so that's alright. Second check we would do during our preparation. So John Smith, polysporin eardrops, 2 drops. Polysporin eardrops, 2 drops. Right ear, 80M. Okay. So then when we do our third check, when I'm preparing my tray, so I have my cloth, I have my eardrops. So polysporin eardrops, 2 drops. John Smith, right ear, 80M. All right, so that is all our checks done. So we can go ahead, grab our equipment, head to the patient's room. So upon entering that patient's room, I'm going to provide privacy. I'm going to close all the curtains. I'm going to introduce myself. Hello, my name is Monique. I will be your nurse today. I'm going to perform hand hygiene. All right, I'm going to put fresh gloves on as well. I'm going to go ahead and check our patient identifiers. So, can I get your name and your date of birth? So, we're going to compare this against our MAR. So, John Smith, October 21st, 81, October 1st, 81. My patient is O times 3. All right. So we're just going to go over allergies with our patient as well. Mr. Smith, I see you're allergic to codeine. Is there any other allergies you're aware of? No? Okay, great. At this time too, we could do a bit of an ear assessment. So hitting his right ear, I can see here, it's maybe got some redness, some swelling. We're just going to make sure we take a good mental note so we can add it to our documentation later. We're going to go over additional rights with our patient. So the right reason, polysporin eardrops are used to treat ear infections. Okay, they contain a pain reliever and antibiotic to treat the infection. We'll give them the right education. So we want to let Mr. Smith know that he needs to avoid getting water in his ears until the treatment is complete. And we want Mr. Smith to know that he always has the right to refuse your medication. And if there's no issue, Mr. Smith, we will continue. Okay. So what we want to do first things first is, and something to note is our medication should be room temperature. Shouldn't be cold, shouldn't be hot. We're going to position our patient, help them get onto their left side here with their right ear, so their affected ear facing up. Just going to be right on their lateral side. Big ear. And then we're going to go ahead, we're going to wash, rinse, and dry the ear as well as possible. And we're going to work from the dirty way out to the clean area. We're just going to be making sure we're not pushing wax into their ear. And just being as gentle as possible just to get rid of any secretions or dirt that has accumulated in the ear. Okay. Then we're going to go ahead and just add the drops to the ear. So we just want to keep communicating to our patients, especially since they can't see what we're doing, that we're about to drop some ear drops in, and that they need to just stay in place for 2 to 3 minutes. So I'll go ahead, I'll drop it as directly into the ear canal as possible. So making sure it gets right into the ear as far down as possible without actually touching or contaminating it. So we'll give them that couple minutes to let the medication absorb. So when that's all done, we can help them get into the position they want to be in. We want to make sure they're comfortable. Do they need anything else? Blankets? Do they know where the call bell is? If not, then we just collect all our anything we brought in with us, our garbage, da da da. If I had put the handrails down, which I did, I want to make sure the handrails are back up before I ever leave the side of the bed. Alright, so then we can go ahead, we can dispose of any garbage, gloves, etc. We're going to wash our hands, of course. So then we're going to go ahead and do the right documentation. So we're going to take our MAR here. We're going to locate Polysporin eardrops, 8 a.m. So I'm going to go ahead and sign that. We want to do the right evaluation. So was the medication administered properly? Yes. Were there any adverse reaction signs? No. It looked good. Everything had caused no pain. No. And then we're just gonna make sure we keep going around every 5 to 10 minutes. Not every, but initially anyways, to make sure there's no adverse sign reactions and the patient is still comfortable and feeling good.